In the meantime, I've been putting some pieces together. And my piece is Whole Health Care. I'm Dr. Steve Ventola. What I do, I provide telehealth. Have you heard the term telemedicine? I'm going to let you read this. I provide telehealth to individuals who want to understand and address their health concerns in a natural, healthy way. Have you seen commercials about virtual health care from hospitals? It's the upcoming wave. Telehealth, telemedicine is 21st century healthcare. I'm looking to be a telehealth care provider now and looking to help people understand their health concerns. And I'm sure when you have a health concern, if you understand a little bit better, it puts your heart more at rest, which can help you to think through the health and healing process. My story. At 12, I was attracted to a book called Nutrition for Athletes. I was playing sports, and at 12 years old, I made the connection what I ate played a part with my performance. That led me to have a constructive interest in the health field. There I became, from next step, I became a public school teacher, honored to be a gym teacher. I became a gym teacher and health educator, along with coaching sports. Then I became pain. Now, Dr. Nick, you may realize this too. It took me to realize this too. Not all concerns come from your spine. My hip pain has been associated with inflammatory bowel disease. Sometimes internal systemic inflammation may be causing the joint problem. And I was going about it looking to get adjusted by my friends, but it was for me, that was the wrong approach. The approach is more looking at systemic inflammation related to inflammatory bowel disease. That escalated into colon cancer. I was diagnosed last year, February, went through chemotherapy. I'll spare you the picture of what it looked like at this time last year, weighing 127 pounds. Now I'm back up to my normal weight. So it hasn't really been a picnic for sure the past few years. However, past year and a half, I've been out of practice and transitioning, realizing what I can do, and I've had some realizations. Those realizations distilled down to three most important things in my life. You may have come to aware of these things yourself. They have to do with God, people, and service. In terms of God, now during this process, when I had GI problems during that initial time, I published a book. I put together a book called Healing Verses of the Psalms. And I distilled down the gems in the chapters of the Psalms in terms of just the sound bites that really are the gems of the Psalms that just person picking up the book can receive. I receive a spiritual invigoration in the moment. I actually use this, I used it during the process, and I continue to this day. I read a Psalm every night and meditate on it in the morning and carry it with me during the day. In terms of people, something I realized to get through this process was the importance of sharing. Now, I'd call the chemo tank, the chemotherapy place where there'd be other people having chemotherapy, and I found that, believe it or not, I actually enjoyed going there, not so much for the chemo in my veins, but more to actually meet the people going through the same process and the things we had to share. That really helped invigorate me and realize what I shared with them, I need to share with people in my world. So that's why this is full transparency in terms of what I've been through. In terms of service, I've had a chance to, during this time, to reinvent myself. That reinvention relates to my service responsibility that I feel that I have, is to use my experience, knowledge, and abilities to lead people to greater health. I realized we're to lead. Now, each of us have our own professions, and we are experts in those professions. We need to lead the people in terms of knowing more about them. My specific area is to lead people to greater health, using the abilities I have now. Now, I'm not able to practice like I did before, but I'm doing what I can do. I've developed this telehealth, this dawned in my consciousness, a telehealth whole health care template. Now, this is what I realized during the past year and a half of what I have to offer to people. Whole health care stands for care to understand, assess to know, R is recommend to help, E is encourage to greater health. Care to understand the whole person. I had a chiropractor mentor tell me, you like this, Dr. Nick, that A person coming in to see me as a chiropractor, they're not just a spine walking into your office. They have a heart, they have a mind, they have a spirit, they have a whole person to them. And to listen, caring enough to listen to the person. I find just inviting people to have a conversation with me, taking the time, the necessary time, it could be 20 minutes, it could be 10 minutes, it could be an hour, but having a conversation, and out of that conversation, along with me asking questions to see a little bit deeper what's going on, serendipity usually always happens in terms of discerning next steps. Those next steps have to do with assessing to know. That's a compass, not a watch, for those in the back there. So we need a direction to move it. That direction has a lot to do with looking at lab assessments. There are many lab assessments. You had your blood test, but there are many other type of blood tests, saliva test, urine test, adrenal test, hormone test. So where do we start? I found two central places to start. The first one is NutriSync Genetic Nutrition and Fitness Assessment. I have brochures about that here. This is a lifetime map to maximize your genetic potential for health. Epigenetics. It will tell you, fitness-wise, you look like a fitness coach, Michael, rather than a financial coach.
I am as well, yes.
It will tell you, fitness-wise, the percentage of, say, endurance versus power, according to your genetics, to maximize your potential. It will tell you need, say, 30% endurance activities and 70% power activities to maximize your specific genetic potential. It will tell you what kind of exercises your body may need. It will also give you an idea of what kind of nutrition your body will need. To me, this is the big picture. Epigenetics has to do with your lifestyle choices. We're finding the choices we make turn genes on or turn genes off. Your genes are your genes. They don't change, but the expression of your genes changes. So you want to turn the genes on, then enhance your health, and turn the genes off that lead to disease. The next test is mediator release testing food sensitivity test. Again, I've narrowed down two starting points. This test is for people to navigate, it's an immediate map, to navigate through intense health concerns or health performance optimization. Let me tell you, intense health concerns. I wish I had known about this test when my GI problems first started, because I was going to my friends and they were looking to address my concerns, but nothing was working. I feel if I had done the MRT test at that point, it could have diverted the path my body went into. In terms of health performance optimization, lots of athletes have done testing like this, because what it does, if you find the foods that work for you, it decreases the inflammation, it cuts out the foods that are causing inflammation. Foods that cause inflammation, I would say, slow down your body. There's been baseball players, basketball players who've done this, and it helps to optimize the performance. Now we're all here, we're business people, we're our own entrepreneurs. We need to be as productive and effective as possible. So this kind of test can raise your game. How much time is that?
Another minute.
Another minute? Okay, recommend to health. Lifestyle medicine. Now the choices we make have a lot to do with turning those genes on. I'm going to go through quickly. I coach people with these elements: thinking healthy, mastering stress, healthy eating and drinking, fitness, friendships, and sense of community. Blue zones, a common factor is our sense of community. When we have that, it improves the quality and quantity of our life. All of our health, we're not supposed to be healthy on our own, but we're supposed to be in position to play our part with others. I might need some extra time here, you mind? Recommend to help, the R part. Natural support. Now there's lots of natural supports. There's electrical therapies. I found I have a pair of orthotics, special orthotics in my shoes that have been helpful with my hip. Nutritional supplementation. There's a product called curcumin that I've been using. It's a derivative of turmeric, and that's been helpful for the pain in my hip. Finally, I was able to come to these meetings on a consistent basis where before I wasn't able to do that. symptom survey. Now, there's a symptom survey with lots of different symptoms, many symptoms that you look to approach nutritionally rather than jumping to a medication. Look to try that, do that first, because I'm getting the speeded up version here. Stay, bear with me here. Encourage to greater health. Coaching strategies, this is what I do business-wise. Single sessions if needed. 3-month health programs. People need to be engaged in the health process. If I have a single session with someone, usually they might hear me, but they don't maintain it. Having an ongoing program helps to establish those healthy habits. Ongoing supports, self-tracking. We all need to self-track in order to stay on track. I help coach people with that. Cultivate and establish healthy alliances and healing partnerships. This is the summarization of what I do. This is the template I use in each one of my sessions. I care to understand first. I assess to know to see what's going on. I recommend to help. I encourage a greater health, and I encourage people to develop healthy partnerships with me, with the people that they're closest with, because when you develop a partnership, it goes beyond yourself and it establishes what you need. It helps to establish within yourself to make those right choices. Play your part. Now, we all have parts to play here. Today, I'm asking you to play your part with me to expand the influences of health through people. The part you can play is simply invite someone you know with a health issue to have a conversation with me. I love having conversations with people, whether they become a patient with me or not, but out of that conversation, again, serendipity happens in terms of what next steps would be helpful for them, as well as seeing what they can do, possibly working with me. Referrals, great trainers for me, personal trainers. That NutriSync recommendation, again, I can give the personal trainer the genetic breakdown of what that person needs in terms of to maximize their genetic potential regarding exercise, and having a personal trainer design a program for them based on those percentages. Coordinators for arranging speakers. Now again, I love speaking, and I hopefully have more time in other places, but I give a talk called How to Master Stress and Fulfill Your Life. I feel like everybody needs to hear this talk. I would love to offer it on a lunch and learn on a corporate level, along with my book, Healing versus the Psalms. I think a church venue would be a very good one, as well as any other organization. Last is other healthcare practitioners. I have a friend of mine who's a psychotherapist, and she realizes my work can be helpful with her work, because when she's at a standstill with individuals who are having a problem, just helping them feed them rightly nutritionally has a lot to can help them mentally and emotionally, and help in her work. Last is answering the call. Martin Luther King, life's most persistent and urgent question is, what are you doing for others? So those are things you can do for me, but if you have an affinity for what I had to say, but if you have affinity for anybody in this room, what can we do to help each other's business? Not only ourselves, but again, what can we do to help our families, our friends, our acquaintances, our work environments? Having that question in terms of what we can provide is essential in terms of our motivation to keep moving in the direction we need to do in terms of offering the influence we were meant to offer. Thank you for the extra time.
No problem.